I recognize the Honourable Leader of the NDP.
Thank you. My question is also for the Premier. For many months, our caucus has been urging the Premier to waive pharmacare fees for families and seniors so that they have a shot at affording groceries and their medication. There's an idea. Those fees are administered by a private company, Medivy. Even though this government says they're going to do whatever it takes to fix health care, they haven't imposed any penalties or fines on Medivy's subsidiary, EMCI, when they breach components of their contract to provide ground ambulance services, and things continue to worsen. Is the Premier protecting Nova Scotians or Medivy's profit line?
I recognize the Honourable Premier.
Thank you, Madam Speaker. There's no questions. There's issues with EHS and the ambulance service here. You know, of course, we're proud of the improvements we're trying to make with the fixed wing. Lots of people are benefiting from that fixed wing service, and many other innovations we've come up with along the way. But I will just assure the member, I mean, there's only one thing that drives me every morning when I go to bed, and that's to look after Nova Scotians. I'm focused on that. We don't get everything perfect, Madam Speaker, but we are always coming from a place right here to put Nova Scotians first.
I recognize the Honourable Leader of the NDP on her first supplementary.
TELUS is another big corporation that's making big business out of private health care in Canada, including here in Nova Scotia, where they run virtual health services for profit funded by the public purse. Why won't the Premier find a way to hire more healthcare professionals to provide public services instead of paying corporations like TELUS to do it for them?
I recognize the Honourable Premier.
Thank you, Madam Speaker. And we're only concerned with access to care for Nova Scotians, and we make sure I believe in the public system. I'm a supporter of the public system. You know, Nova Scotians have access to public health care. We have no intentions of privatizing health care in this province. That's a narrative that the NDP will sometimes push. I just want to assure Nova Scotians, not going to happen. But making sure Nova Scotians have access is what will happen. That's what we're doing. And if it means working with private companies to make sure that people can get the care, we'll make sure they do that too. I know lots of Nova Scotians that got their vaccine at a pharmacy. And you know what, Madam Speaker? They didn't complain to me. They went to a pharmacy. They said they're happy they got their vaccine. We will work with those making sure they get the care.
I recognize